Hello and welcome to Simple Drug Reviews. In this video, we'll be discussing gastroesophageal reflux disease, also known as GERD, a very common condition that affects millions of people worldwide. By the end of this video, you'll understand what GERD is, why it happens, its symptoms, possible complications, and the most effective ways to manage it. If you find this video helpful, don't forget to like, subscribe, and turn on notifications so you never miss new videos. Let's get started. Gastroesophageal reflux disease, commonly known as GERD, is a chronic condition in which stomach contents, including acid, flow back into the esophagus. This backward flow leads to irritation of the esophageal lining and results in troublesome symptoms that can significantly affect daily life. Pathophysiology. GERD occurs due to dysfunction of the lower esophageal sphincter, also known as the LES, a muscular ring that normally prevents reflux. When this sphincter becomes weak or relaxes inappropriately, stomach acid is able to move upward into the esophagus. Other contributing mechanisms include increased intra-abdominal pressure, delayed gastric emptying, and the presence of a hiatal hernia. Risk factors. Several factors increase the likelihood of developing GERD. These include obesity, pregnancy, smoking, and alcohol consumption. Dietary habits also play a role, especially frequent intake of fatty or spicy foods, as well as caffeine. In addition, certain medications, such as nonsteroidal anti-inflammatory drugs and calcium channel blockers, can contribute to the condition. Clinical features. GERD presents with both typical and atypical symptoms. The most common symptoms are heartburn, a burning sensation in the chest, and acid regurgitation, often described as a sour or bitter taste in the mouth. Atypical symptoms may include chronic cough, hoarseness, sore throat, and chest pain, which can sometimes mimic cardiac conditions. Complications. If left untreated, GERD can lead to several complications. These include inflammation of the esophagus, known as esophagitis, and narrowing of the esophagus, referred to as strictures. It may also progress to Barrett's esophagus, a condition that increases the risk of esophageal cancer. In severe cases, there is an increased risk of esophageal adenocarcinoma. In addition, repeated reflux of gastric contents can result in aspiration pneumonia, where small amounts of stomach acid enter the lungs, leading to inflammation and infection of the respiratory tract. Another important but often overlooked complication is dental erosion. Frequent exposure of the teeth to gastric acid can gradually wear down the enamel, resulting in tooth sensitivity, discoloration, and increased risk of dental decay. Diagnosis. GERD is primarily diagnosed based on clinical symptoms. In many cases, a trial of proton pump inhibitors is used both for treatment and confirmation of diagnosis. For patients with severe or alarm symptoms, endoscopy may be performed to assess the esophageal lining. Additionally, 24-hour pH monitoring remains the gold standard for confirming acid reflux. Management. Lifestyle modifications. Management begins with simple but effective lifestyle changes. Patients are advised to lose weight if necessary, elevate the head of the bed during sleep, and avoid late-night meals. Reducing the intake of trigger foods such as spicy meals, fatty foods, and caffeine is also important. Smoking cessation and limiting alcohol intake are strongly recommended. Pharmacological treatment. Medications play a key role in managing GERD. Antacids provide rapid, short-term relief by neutralizing stomach acid. H2 receptor blockers, such as ranitidine, work by reducing acid secretion. However, the most effective treatment is the use of proton pump inhibitors, such as omeprazole, which provide strong acid suppression and promote healing of the esophageal lining. Prokinetic agents may also be used in selected cases to improve gastric emptying, although they are less commonly prescribed. Surgical management. For patients with severe or treatment-resistant GERD, surgery may be considered. The most common procedure is fundoplication, where the upper part of the stomach is wrapped around the lower esophagus to strengthen the lower esophageal sphincter. This helps prevent acid reflux and provides long-term symptom relief. Patient counseling. Patients should be advised to take proton pump inhibitors before meals, typically in the morning for maximum effectiveness. They should also avoid lying down immediately after eating and remain consistent with lifestyle modifications. Importantly, any alarm symptoms such as unexplained weight loss, difficulty swallowing, or gastrointestinal bleeding should be reported promptly. In summary, gastroesophageal reflux disease is a common but manageable condition caused by the reflux of stomach acid due to dysfunction of the lower esophageal sphincter. With appropriate lifestyle changes and effective medical therapy, most patients can achieve excellent symptom control and prevent serious complications. Early recognition and proper management are key to improving quality of life and reducing the risk of long-term complications such as Barrett's esophagus. Thank you for watching. If you enjoy this video, hit the like button, comment in the comments section, and please subscribe.